As a last question, a lot of people that I talk to who are not as familiar with addiction or mental health, either look down on it and they say, okay, well, those people, or even if they're going through it, they say, I'm not an addict, or I'm not, I don't have a disease. And so how much of this is a choice and is based on willpower versus how much of this is a disease and it's just not necessarily something that somebody chose to do or has a control over? I think a lot of people have a misconception about this.
And I think some of that is because it's not clear. Totally right. I mean, there's certainly some people are very prone to drugs, in other words, becoming addicted to it. So there is a brain issue that some people develop addiction. Look, not everyone who experiment with drugs become addicted to it, right? I mean, there's plenty of people who go to college who experiment with alcohol and cocaine and some other drugs and use it recreational and don't develop addiction or dependency to it. Then you have the cohort of the one of the issues with like say fentanyl, whether you have this addictive part of your brain or not, your chances, even if you did or not, becoming addicted to that kind of drug is pretty high. Methamphetamine, the rates of addiction is pretty high as well because the high is so intense. So you have these drugs that kind of, unlike say marijuana and alcohol and maybe some, traditionally snorting cocaine may not lead to an everyday addiction. These other drugs typically do because the high, once you experiment or do that once or twice, you're off to the races no matter who you are, right? Now, the brain part comes into some people or can get off of it a little bit easier and may not relapse as far as or have the same type of relapse potential as some, so there's the brain quality to it as well. So it is so complicated. Obviously, starting using drugs, obviously there's a choice, right? Whether it's using gateway drugs like marijuana or other drugs, or even just starting hey, you want a hit of this, or hey, you want to try this. Obviously, there's a choice there, right? But again, with some of these other drugs, it becomes a problem that the choice is taken away from you because I've seen some people do some crazy things just to get that drug. I mean, again, it's like Russian roulette. You may not live. You just think about it. You're using a drug and it's a possibility because you're seeing other people die from it,